Hi, this is Dr. Berardi, and we had a question come through social media involving, or they were asking, what was my first surgery that I remember coming out of residency? And I don't know if it was exactly my first surgery, but I remember the very first surgery where I was in the operating room and I actually felt very anxious, very nervous. And of course, this was almost 15 years ago, and it was a child, an 8-year-old boy that got in a car crash and broke the bones in his face in this area. We call it a zygomatic fracture. And not only was it a fairly difficult fracture to fix, but also a child. So you kind of add that added complexity to it. And the reason I was doing this because I was taking trauma call at St. Joe's, which involved doing plastic surgery on people that were injured, whether it's a flap to the leg or repairing facial bones that are broken or doing skin grafts on burns. We were doing essentially bread and butter plastic surgery, everything we learned in our training. So got a phone call and I'm looking at the CT scan, said, okay, he has a zygomatic fracture, and then we're in the operating room. And all of a sudden I'm going, wow, this is probably the first time I did a cranial facial case without supervision, and obviously everything went well, but for some reason I can remember precisely the way the bones were fractured and what I had to do for him. And it's strange because you do your residency training, and with surgery it's going to be a minimum of 5 years. And during that 5 years, your first year you're watching surgery. You're doing a lot of work on the floor where you're signing notes and doing histories and physicals, and you're discharging patients. And every once in a while you get in on a minor procedure, whether maybe it's a cyst or a mole or an abscess that you as a first year surgical resident get to do. And then as you progress through residency, say your second year, you're doing more stuff like hernias and learning laparoscopic procedures, and doing some plastic surgery. In plastic surgery, we're mainly doing burns, and it might be that mole excision that we spoke of. And then as you progress, you start doing bigger and bigger cases, and you have less and less supervision. And toward the end, you're actually supervising the younger residents on how to do procedures. So typically you may have like an intern or a first year surgical resident, you'll have a third year resident, and then you may have a chief. And then on top of that, you have the attending physician, who is the boss, who has already been through all this and likely doing plastic surgery for a number of years. So the transition through residency, and then finally you're out on your own. And despite all that training, there probably was some moments where you're nervous, you're thinking, am I doing the right thing? But here I am 15 years later, and with 10 years of trauma surgery behind me and tons of craniofacial cases, and now a thriving aesthetic practice, I think the nerves are gone for sure. So have a great afternoon, and we'll talk to you next time.